a very common condition that affects children from the ages of 9 or 10 through until 15 or 16 years of age is a condition called Osgood-Schlatter disease. Sounds like a complicated name, but it's a name that pertains to an irritation of the growth plate of where the patella tendon inserts into the shin bone. And this is a condition that usually comes on from jumping and landing and quite active children through their growth spurt. It's a condition that's affecting the bone of where the secondary center of ossification gets quite irritated. And if we see this x-ray, this is the kneecap at the front. The patella tendon comes down and inserts into this little bone here. It's where the bone gets irritated as it attaches onto the shin bone. And it's essentially a bony growth plate irritation. And you can imagine from jumping and landing, the tendon, as it inserts into the bone and then into the shin bone, gets irritated. It's usually associated with kids that are doing an increase in activity and have the growth spurt. In a nutshell, the most important thing we need to do, and why a lot of treatment for this fails in different clinics and different advice from surgeons, is that we don't reduce the activity for a long enough period. We believe the best way in treating these is to put the adolescent into a knee range of motion brace that they keep on 24/7. They keep on 24/7. They're allowed to take it off, when they sleep and when they bathe, but they keep it on the rest of the time. The advantage of a brace like this for 4 weeks is it stops them jumping and running, even if they're out of your sight, down by the pool, in the playground at school. And that reduction, they can walk normally, they don't need crutches, but it just slows them down and they can't jump and run. Once they've had a period of about 4 weeks, we test 3 things on them to see whether it's improving. Palpation, initially when we test them and it's quite irritated, they'll have a very high amount of pain. We check what they're like initially on jumping and landing, and oftentimes they'll report a pain level that's quite high. And then we also do a test, which is a step down test. We do 3 tests and we can get a baseline of where their pain's at. We simply put them in a brace for 4 weeks. We get them starting on some glute exercises and calf exercises, nothing else. Definitely no quad exercises. A lot of physios will try and start strengthening their quad, and however you start to strengthen the quad, and what's the muscle the quad inserts into down through the patella tendon, you'll make the condition worse. So it's really simple. In summary, we put them into a knee brace for 4 weeks. They keep this on except for sleeping and also for swimming. They stop all jumping and loading activities and running around. They start a really simple glute and calf exercise. No quad strengthening until all of the levels of pain around the kneecap, around the patella tendon insertion are down to 0. Then we can start them on a quad program, a quad strengthening program. By that stage, the brace comes off at about the 4 to 5 week mark. We start them on high load quad strengthening as well, low speed quad strengthening for a week or 2. Once they've progressed through that and they still don't have any pain touching it, squat, or the step down test or the jump, then we can put them onto a pre-jumping program and slowly increase the amount of force through the knee before we put them back into sport. And we put them back at a lower level of sport initially until they move their way through that program. This is a very economical and quick way of dealing with this condition. And again, my suggestion to parents is we've got to be quite hard and direct and give clarity about reducing the level of activity, and our results are excellent with this. And I'd have to say in a very high percentage of cases, 95% of cases, after 4 weeks in a knee brace, their pain levels are significantly reduced. I know that it's tough love initially, but we see very good quick results with this, and it's a more economical way of doing it. My biggest concern, sometimes we'll have kids that come in who have had this condition. they'll have been given the advice of reducing their activity level by 50% and reduce a couple of training sessions per week. It never makes any difference. You've got to really reduce the force significantly, and that's no jumping and running. And we, from our perspective, that hard and fast approach initially then gains trust within the patient, the child. They trust us because the pain starts to go. Then we can increase the level of activity. I always sort of explain it. If you've broken a bone in your arm, you've fractured the bone, because this is a bone problem, what do? We put you in a cast for anywhere between 4 and 6 weeks. We immobilize it. And that's how long it takes for this bone to start to feel better and to get better. Then we can take you out of the cast and start exercising it. You don't go back to the doctor when you've had a broken bone in 1 or 2 weeks going, yeah, it's feeling a bit better, let's take you out of the cast. You need to reduce the force for at least a 4-week period, and then we progressively increase it. Again, there's a lot of background noise for the treatment of these. Oh, make sure Johnny's put into an orthotic to stop him pronating in his foot. Make sure, put on deflan gel or ice and all sorts of lots of hands-on physio. That's rubbish. The bottom line is immobilize, allow them to keep walking around but taking the load off from running and jumping, and then slowly build the strength up through, as I said, calf, glute and quad strengthening in a progressive manner. This way, you'll have a successful treatment regime for the treatment of Osgood-Schlatter disease. Thank you.